And non-healing wounds are an issue for many patients, but there's a new treatment that could help. Here with details is Dr. Mir Ali with Memorial Hermann Cypress Hospital. Thanks so much for being here.
Thanks for having me.
Well, let's first talk about, first of all, November, which we're coming up on here in just a couple days, is Diabetes Awareness Month. And this is really your time to get out and really educate everyone about this disease.
That is correct. I mean, there's so many complications that can occur because of diabetes. Diabetic foot ulcer is a big one. I think, as you mentioned, 30 million Americans suffer from diabetes, and roughly a quarter of those patients will go on to develop a diabetic foot ulcer at some point. So it's a huge issue.
1 out of 4 people then.
Yeah.
And talk to us exactly, I mean, when you say develop a foot ulcer, let's talk about what exactly that means, because I'm assuming this really plays a large role in limiting someone's mobility.
Yeah. I mean, so diabetes is a disorder of sugar management, of sugar control, right? And so that elevated long-standing sugars can affect the peripheral nerves and cause you to not be able to feel as much in the bottom of your feet, and then also cause the sweat glands to not work as well, so you get cracks, and you get you can rub a hole in the bottom of your foot,
and really not feel it, right?
Right, exactly, and that's the dangerous thing about it. We've had patients that have come in after playing 9 rounds of golf and didn't know they had a key in the bottom of their shoe.
What?
Yeah, just all sorts of things happen. And you know, the first thing that oftentimes gets a patient's attention is the smell of an infection. So.
And when you're smelling it, the infection then is quite serious.
Yeah, I mean, it can be, or it can just be some drainage from the wound that's just not cleaned up. Generally, redness, warmth, swelling, odor is another one, but those kind of things are tip-offs to infection. But diabetic patients really should be checking their feet every day, multiple times a day, you know, just to make sure that they're not getting cracks or, you know, any kind of open wounds.
Because it can open really, I guess, if you look in the morning and then don't look for another day or two, the tear in the open can happen relatively quickly.
It can happen very quickly. You know, just think about if you've got a pressure point in the bottom of your shoe, you know, you notice it throughout the day while you're walking and it hurts. But a diabetic patient doesn't, and you know, when you get home, you see that little red knot on the bottom of your foot. And they don't. And so, I mean, these calluses develop, and underneath the callus, you could develop an open wound.
Very problematic. And Dr. Ali, just to be clear, these are not wounds that someone can put ointment on and a Band-Aid and call it a day. Someone needs to go to an advanced wound care clinic.
Yeah, absolutely.
Why is that so important?
For one thing, diabetes or diabetic foot ulcer is a very multidisciplinary type of wound. It could be an issue of blood flow. It could be an issue of an undiagnosed infection. There could be too much swelling around the wound. You know, the pressure on the wound may not be relieved. So there's all sorts of different things that we do in the wound care center to kind of address the wound.
And we're seeing, by the way, some of the other treatments that you offer at the wound care clinic. So foot ulcers, radiation injury wounds, pressure sores, and even sores that are not visible open wounds. So do patients with these issues, do they typically heal more slowly?
They can. Like I mentioned, it's a kind of a, you know, it can be very multifactorial. You know, you can have a lot of different issues, and if something goes undiagnosed, if you've got a blood flow issue, then it can heal very slowly, or not at all, even. It's not like an acute wound. There's different types. There's acute wounds, like if you cut yourself, you know, while you're cooking,
right.
Then you expect the wound to progress through the normal phases of healing. But with chronic wounds, wounds that have been present 3 or 4 weeks and haven't healed by at least 50%, they follow kind of a different physiology. And so it's our job to kind of go in there and tease out what's causing that problem and address it.
And I would say, too, like going to the wound center would be ideal for these types of patients, as opposed to just going into
like a doctor's office
or an emergency clinic or something like that, because you're so equipped with different treatments and options.
Yeah, you're right. We do weekly debridements where we go in and do minor surgical procedures and clean up the wounds. We do all sorts of advanced wound care products, skin substitutes, stem cells in many cases. We do negative pressure wound therapy, which is kind of a fancy way of we apply a suction to the wound to help it heal. We do hyperbaric oxygen therapy. And so at Memorial Hermann Cypress, we've got all different kinds of things available to us.
What exactly is hyperbaric oxygen therapy, also known as HBO therapy?
Yeah. It's we put patients in a long 7.5-foot tube. It's a clear acrylic tube. The whole patient goes in, we seal it, and then they breathe 100% oxygen under higher than atmospheric pressure. So like here at sea level, it's 1 atmospheric pressure. in the chamber, it's anywhere between 2.5 atmospheres, 2 and 2.5 atmospheres of pressure. So when you do that, you're able to push more oxygen into the bloodstream. You're able to saturate it a little bit more fully, and then deliver more to the wound, build new blood vessels. You're able to fight infection better. You're able to build new tissue in an effort to heal these wounds faster.
That is so fascinating to me.
Yeah, it's really neat.
To see that.
Okay, so let's say someone at home, let's say they have a wound on their foot. What types of things should people really be watching for, and you know, that would indicate that there is a larger problem going on?
You know, if there's an infection going on, the redness, the swelling, the warmth, that's the sign of infection. You know, there can be other more difficult things to tease out, like a bone infection or a blood flow problem. They may have trouble. They may have problems when they walk. The legs may get cramped. They may get cramping in their legs, which may indicate a blood flow issue. And there's a whole host of things that they need to be looking for. But I'd say, you know, if you've got a wound that's not healing in a timely fashion, then you may have something like this that needs to.
It could indicate a larger problem.
Yeah, if you're dealing with this month over month, then there is a problem. The good thing is about Memorial Hermann Cypress is that we can go in for an evaluation, say, hey, I don't know if this is normal or if I need further help. You kind of just go in and see you and get the eval.
Exactly. We accept self-referrals, which is a great thing. We're a specialty that's, I think, you know, one of the few that does that kind of thing, where you can call and just get an appointment. And we'd love to see you sooner rather than later. I mean, to deal with this, because the larger the wound gets, the longer it takes for it to heal, the more likely there are going to be complications in terms of infection and potentially amputation. I mean, you know, so it's better to get ahead of it early.
And for you, I would imagine even a small wound, to track something like that and to see how the healing process for that patient is happening, as opposed to seeing it on the larger scale, right?
Right. It's, I mean, if we can see it up front and deal with it, I mean, you know, it's easier for us, you know, and it makes it easier for the patient as well.
Dr. Mir Ali, thank you so much for stopping by and answering our questions. Yeah, very interesting. 1 in 4 diabetics. Who knew?
Up to 1 in 4, yeah.
Also, as Courtney just mentioned, if you'd like to schedule an appointment with the specialist at Memorial Hermann Wound Care, you can call 346-231-4000, or you can visit them online, memorialhermann.org/Cypress.
Thanks again.
Yeah,
we'll be right
pleasure.
back.